Almost every patient who has plastic surgery asks me what they can do to minimize their scars. Everyone seems to want to intervene, and sometimes the best course of action is leaving something alone. So I always tell a patient, definitely the first 2 weeks as things are healing, to just leave everything clean and dry. We don't want someone putting on ointments or salves and creating any sort of contact dermatitis or rashes or vitamin E, which can make the scar worsen or get wide. So I always recommend keeping things clean and dry for at least 2 weeks. After that point, it's very important to keep the scar hydrated. So whether you use lotions or oils, that's going to be very important. The other things that work best for scars are silicone sheeting, and then there's a newer product out called Embrace Scar Therapy. If a patient's going to be using silicone sheeting, she needs to wear a silicone gel pad on the scar all day, every day, for 6 months or longer. So there can definitely be an issue with compliance. If a patient isn't going to be using silicone sheeting all day, it's just not going to work. The other thing that's come out more recently is something called Embrace Scar Therapy, and that's an 8-week course of treatment, and what it does is it keeps tension off of the scar. And tension can be a big risk for why a scar would widen. So Embrace, it's a pad that you would wear on the scar. It's an 8-week course of treatment, and it keeps tension off the incision so it heals narrow and thin in a fine line. If a patient is prone to darkening of her scars, if she's prone to pigmentation, then what I recommend is bleaching cream, something called hydroquinone, which we have them use twice a day for several months. The main thing after having any sort of scar or having surgery is just simply being patient, because scars fade over time, and it takes a minimum of a year for a scar to mature and fade to natural skin tones. So my best advice for patients is simply to just be patient, and it would be very rare to have some sort of highly conspicuous visible scar after a year.